Estoy con el profesor Alan Barkun. Alan Barkun viene de Montreal, de Canadá. Es un experto está en la Universidad de McGill, es un experto en lo que es hemorragia digestiva, alta, baja, en el manejo, epidemiólogo como epidemiology. Alan, comment about what are your highlights on your presentation for our residents about upper GI bleeding.
Right. So I think that in any type of specialized procedural specialty, you always want to do things, but you must always remember stabilization of the bleed. Very important. We only will go ahead and do an endoscopy if the patient is hemodynamically stable, because we need to use medications to sedate the patient, and there are data to show you can actually do things worse if the patient is not stabilized. So always make sure that the patient is stable. Once the patient is stable, then we can go ahead. There's no role in lower GI bleeding for acute colonoscopy. We know that, or what's called early colonoscopy within the first 24 hours. In fact, in a patient who's hemodynamically unstable, and once they're stable, you want to do a gastroscopy to make sure, because 15% of those patients will have an upper source of bleeding presenting the bleeding from below. In a patient who has a clear upper source of bleeding, vomiting blood, vomiting, coffee grounds, we recommend doing a gastroscopy within the first 24 hours following adequate stabilization of the patient. Stabilization would include things like, obviously, fluid resuscitation. We would go ahead and recommend a restrictive approach to transfusion, only if the patient's hemoglobin is below 70 grams per liter, aiming for 90 unless there's active coronary artery disease, and then we proceed with the endoscopy. Always proceed in a controlled area where you have adequate support, the assistant is well trained, you feel comfortable, and you have the tools to allow you to do the procedure, and never worry about asking for help.
Yes.
And then the actual endoscopy, if you do, for example, for peptic ulcer bleeding, we recommend not injection alone, but injection with or alone clips, and thermal, or the combination of injection with thermal.
Yes.
And we would consider using the sprays, so the topical hemostatic products, and more recently with over-the-scope clip, although the cost is quite high, and there are issues about generalizability with regards to operator expertise and patient selection of the lesion that could best benefit from it, particularly as a first-line approach.
Okay. Thank you very much, Alan, for coming to Argentina.
Thank you. Muchas gracias for the invitation.